Alright, welcome everyone to episode number 115 of the Ask Dr. Khan Show. I'm Dr. Peter Khan, functional medicine practitioner, and on this show we'll give you answers that's going to help you solve your health puzzle and also help you get well and stay well. Typically our clients come to us from all over the country. People consult with us via video conference, so we see clients online, and we help people who have chronic health issues, who's been to multiple specialists, nothing's helping them, and they swing all the way to the other side trying some natural stuff and nothing's helping either, then they come to us for answers. So I'm not telling you to brag, but we do have over 110 video testimonials on our website at AskDrKhan.com. Kind of just proof of the results that we get. We have worked with over 5,000 clients, and our practice focuses on addressing the root cause of the root cause. Okay, we go one level deeper, sometimes several levels deeper. And so today we're going to talk about thyroid, because 90% of our clients come to us for thyroid Hashimoto's issues. And that's what we do all day, day in and day out. And so we have a lot of experience with it. We know what works, we know what doesn't, we measure these things. So today I'm going to talk about the true functional medicine approach to managing thyroid problem. And many of you may be watching that suffer with a thyroid condition, or you may have a family or loved one that has this thyroid condition that's just not getting better. You're taking thyroid hormone, you're taking thyroid medication, but you don't feel much change. Or you feel some improvement, but certainly it doesn't clear up everything for you. You have residual problems, or you have symptoms that's just left unanswered. Furthermore, just because you take thyroid hormone, it doesn't answer the question, what's causing the thyroid problem in the first place? Remember, taking thyroid medication is just one piece of the bigger puzzle. And many people taking thyroid medication may not be even the problem in the first place. So we want to talk about how to actually approach this from a root cause perspective, and how do we actually put everything together, tie it together so the program makes sense, so that you're not just guessing and taking 10, 20 supplements and don't even know why you're taking it. Because many people come to us taking way too much supplements and they're still not feeling better. What does that tell you about the supplements they're taking? It means that they either don't need it, they're not addressing the root cause, or the product simply just doesn't work. So we want to help you avoid those confusion and start to get clarity so you know exactly what your next step should be. Okay, so let's talk about a thyroid hormone clinical case. How do we actually look at a thyroid client, someone that come to us with thyroid problem? How do we actually address the concern? Because standard medical model is giving you a thyroid hormone. Basically, anybody that walks through the doctor's office, if there's any inkling of thyroid issue, either symptom-wise or your lab test showed you have a thyroid issue, regardless of what the root cause of that thyroid issue is, you're going to get a thyroid hormone. And what happens is sometimes people will go to a natural healthcare practitioner. Instead of given a synthetic hormone, they're given a bioidentical hormone. Instead of Synthroid, you're given Nature-Throid. Instead of levothyroxine, you're given Armour. And they're told that the bioidentical hormone is better than the synthetic. Not necessarily. Depends on what's the root cause. What if your root cause is not even a thyroid problem? What if you have thyroid symptoms, and that's just a symptom that you're expressing, but what's causing it is a gut issue? Well, taking thyroid hormone may or may not help. What if you have symptom of thyroid problem, but the root cause is a heavy metal toxicity? Taking thyroid hormone won't necessarily help that. So it's all about finding out the real cause of the problem. So let's talk about a thyroid hormone case. So here we have a thyroid problem, okay? Or I should say a person with thyroid problem. That's a better way to express it. Because we don't treat the thyroid problem, we're treating the person, not the disease. We're taking care of the person, we're not treating a symptom, right? So we're taking care of the person with thyroid problem. In this particular person, the things that we may need to look at may include things like medication interaction. We're going to talk about that in today's episode. Medication interactions. Because there are definitely medications that can slow down, impair, block thyroid function. It'll make your thyroid problem worse. If you didn't have a thyroid problem, just by taking some of these medication can make you have thyroid symptoms. Okay, so you need to be aware of that. Another thing is, actually the arrow should go this way, because medication interaction can cause someone to have thyroid issues. You can have also autoimmune issues. Most people with thyroid problem have an autoimmune component. In fact, according to the Endocrine Society, which is the largest endocrinology society in the world, with all the medical endocrinologists, they confer, they have a conference. They say, according to their position statement, they say that most people with thyroid problem have autoimmune, which is Hashimoto's. Autoimmune disease of the thyroid, which is Hashimoto's, causing the thyroid problem. Up to 90%, in fact. So that means there's a 90% chance that if you have a thyroid problem, it's due to an autoimmunity. Now, if you're never told that you have autoimmune, either you haven't been tested or it's just not being addressed. If you have not been tested, it's because even if they test you and you came out that you have Hashimoto's, the treatment doesn't change. You're getting the same thyroid hormone medication, and that's the standard of care. But standard of care is not good enough. Especially if you're not feeling better, then who cares about the standard of care? You need to go above the standard so you can start to feel better, right? So Hashimoto can definitely be a cause of the problem. Then we have endocrine interactions. That means hormone interactions. Thyroid hormone does not play by itself. It is interacting with other hormones. Thyroid hormone function is dependent and interacts with other hormones. For example, adrenal function can impact thyroid function. Estrogen, progesterone, testosterone, these hormones all can have an impact on thyroid function. So if you have severe estrogen deficiency, that can cause your thyroid hormone to not work. If you have severe cortisol elevations, too much cortisol, stress hormone, can also cause thyroid hormone to not work. So in evaluating someone with thyroid symptoms, remember we want to go beyond the thyroid symptoms and look at the root cause. And sometimes it may not be a thyroid problem. It may be a cortisol problem, a stress hormone that's too much, that can throw off the thyroid. In that case, you want to address the cortisol problem. The thyroid problem will end up fixing itself. Another possibility is brain mechanisms. Brain feedback loop. And we'll talk about that. Your thyroid function, and in fact, all hormone function is dependent on brain function. There's a feedback loop where the brain communicates with the gland that produces these hormones. If your brain's not working properly due to toxicity or fuel delivery problem, diabetes, inflammation, it's going to affect the feedback loop to where you cannot produce stimulating hormone to stimulate thyroid hormone function. That's a possibility as well. So some people, the thyroid gland is working just fine. There's nothing wrong with the gland, but the brain's not talking to the thyroid gland. And therefore, you have low thyroid function. It's actually in the brain. So sometimes when they say it's all in your head, it is true. It could be in your head in a sense that there's some type of neurological issue, not necessarily in your head like you're making it up, right? Which is what a lot of doctor will kind of make the patient feel that way by the way they communicate with them, with their bedside manner. That, hey, it's all in your head. You don't have any problem. Your lab test is normal. Why are you still complaining? Here, take Prozac. You must be depressed. We want to avoid that type of situation. If you're a patient and you have that experience, please comment in the comment section of this video and let people know how common it is. Just say, I've had doctor telling me it's all in my head. Just put that in the comment section. You'll start to see a bunch of people will start pop up and put that in the comment section, telling you that you're not alone. And if you're a provider and that's what you're telling client, you better pay attention because you need to change that type of stance. You need to be in a collaborative position to help your patients, not in a position where you're the authority and they don't know what the heck they're talking about. You need to work with your clients, okay? Work with your patients. Another thing is environmental interactions. Environmental toxicities, really. So with environmental toxicity, we find heavy metal toxicity, heavy metals. We find plastic or phthalate to be a big problem. We find pesticides to be a huge problem here. When we do testing, specific testing for these toxicities, we find these things in our clients often, frequently. and we use specific targeted detox to help our clients get rid of these. But first is identify if that's even a problem. Pesticides, sometimes it's medication, residues, could be a lot of different things, environmental factors, okay? And then we may have immune-activated cytokine interactions. So immune All right, so what does that mean? That means your immune system is triggering some type of cytokine response. Cytokines are immune messengers. They're chemicals made by the immune system to tell each other what to do. So think of cytokines as text messages that your immune system send to each other to say, hey, I have an infection in my shoulder, send more white blood cell. And your white blood cell in the area gets that text message from the cytokines and just goes to the area to try to get rid of an infection. So this can be basically caused by infection. However, it could be caused by other reasons. Anything that can trigger your immune system to release more cytokine. Well, what does that besides an infection? So this could be an infection. Guess what? Food sensitivity can do that too. Remember in the previous episode, a couple episodes ago, we talked about how food sensitivity is not really a digestive response, it's actually an immune system response. It's your immune system that's reacting to the food, not your digestive system. So know that food sensitivity can trigger an immune-activated cytokine response, where your body triggers more inflammation. Infections can do it. In fact, stress can trigger an immune-activated cytokine response. Just by feeling stressed, your body's going to release more of these chemicals, text messages, that's going to trigger inflammation. Okay? So these cytokines are a big deal in the world of immunology, and there are different ways that we can do to actually affect that. Next, and I think we got it covered. Okay, so we have here is some type of immune system activation due to infections, food sensitivity, or stress. We have environmental factors where chemical can actually straight up interfere with thyroid function or inhibit it or block it. We have brain feedback loops. We have other hormones. Autoimmune disease can definitely cause someone with a thyroid problem, and medication interaction. So when someone shows up with a thyroid issue, if the only thing that you're getting is a thyroid hormone without someone looking at all these other aspects, then really you're not getting proper thyroid management. So this is a functional medicine approach to actually managing thyroid successfully, and we have used this model with our clients, in fact over 5,000 clients in the past 10 years, and we have gotten consistent, predictable results. And of course, there's very many variables, and these are just some of it, and you can watch our shows on our Facebook page, Hope Family Wellness. This is where our fan page is. You can watch previous episodes of the Ask Dr. Khan Show. You can also go to YouTube, my YouTube channel at Dr. Peter Khan. You can see over 500 videos of us discussing things like that. So subscribe and follow and like those channels for free resources on more education opportunities. So with the medication interaction, let's talk about some of these medications. What are some of these medications that can actually interfere with thyroid function? You may be surprised at some of the stuff that's really common. So things like your anti-inflammatory agents, anti-inflammatories, things like your NSAIDs, non-steroidal anti-inflammatory like Motrin, ibuprofen, your antibiotics. Antibiotic can interfere with thyroid function. Antidepressants can interfere with thyroid function. Diabetic medications can interfere with thyroid function. Hypertensive medication can interfere with thyroid function. Pain medications can interfere with thyroid function. Antacids can interfere with thyroid function. Cholesterol lowering drug can interfere with thyroid function. Now, if you look at this list of medication that can interfere with thyroid function, cholesterol drugs, hypertension drugs, diabetes drugs, antacids, pain meds, antidepressants. Are those common? Is there a lot of people in our population taking them on a regular basis, even addicted to some of these medications? You bet. And just even one of these medications can have an effect on the thyroid. What if someone is taking multiple medication? Do you know someone who's taking multiple medication? Put, I know someone taking multiple medication in the comment section. You know someone's taking more than one. They take any of these, more than one medication. Say, I know someone taking more than one. Maybe you can put, I know someone taking 5. Put down a number, the highest number that you've seen. It boggles your mind how many people are taking these medications and they all interfere with the thyroid. Of course, now they're saying, oh, you have a thyroid problem, let me give you a thyroid medication too, without addressing the interactions that may be happening. Not just that one factor, how about these other ones? So medication can definitely affect thyroid function in a way that it can alter thyroid hormone secretion. It changes the way that your thyroid gland even makes hormone. It can decrease the absorption of those hormones at a cellular level. So you can make the hormone, but you got to be able to absorb it. It's going to decrease that. These medications affect thyroid hormone binding globulins. So these are transport proteins. So it's going to affect how your body is able to transport thyroid hormone. It alters thyroid stimulating hormone responsiveness. So the brain makes TSH. It can change how responsive your thyroid gland is to that TSH. It can also alter the ability of your body to eliminate thyroid hormone. So you make the hormone, you got to get rid of it. These medications can affect the clearance of it. It can alter thyroid receptor levels. It can dysregulate the feedback loop, which we'll talk about in just a little bit. And it can also decrease T4 to T3 conversion, because when you make the hormone, you got to convert it from the inactive T4 into the active T3. These medications can affect that. Now, I'm not telling you to get off these medications today, because you got to work with a qualified healthcare professional, and as you get healthy, for example, working with us, then you get to the point where you perhaps may be able to wean off these medications, but only if you're showing that you no longer need them, and you have to substitute something, right? You don't just stop taking it without doing something different. You might change your lifestyle, change your diet, using specific supplements, and actually address the underlying root cause. When you do that, though, you may be able to get to the point where your symptoms go away because you're healthier, then you may no longer need your medication. Okay, so don't stop anything that you're taking without working with a qualified healthcare provider, and we can help you with that. Next, let's talk about some of these hormone interactions. Know that with hormones, so we talked about hormones here. One of the hormones that will affect everything is cortisol. Cortisol is a hormone made by the adrenal gland. It's basically a hormone that helps you regulate your blood sugar, also help you decrease inflammation. It's like a stress hormone that's made. Cortisol, when in high amounts, will basically knock off all your other hormones. It'll make your other hormones not work. It will cause depression. High cortisol level can cause depression, can interrupt with your sleep. It'll cause memory problems because cortisol overwhelms the temporal lobe, which is where you convert short-term into long-term memory, can lead to Alzheimer's disease. Cortisol causes belly fat. Cortisol causes blood sugar issues. It basically throws off all your sex hormones and makes them not work. So cortisol is basically the hormone that for most people, that's what's causing the issue. It's not usually because you don't have enough estrogen or don't have enough testosterone. It's usually because you have either way too much cortisol because you're stressed out of your mind and you're inflamed like heck and your blood sugar sucks. And that's why this is throwing off your testosterone, throwing off your estrogen. So taking estrogen or testosterone without fixing cortisol is going to lead to very limited results. You must address the underlying reason, which usually is dietary, is lifestyle, is stress management, infections, toxins, eating whole fresh food instead of processed food. It's not as difficult as you think, but you do have to have a way, a sequence, so you're doing the first things first, the second thing second, the third thing third. And what most people do is they go straight to the hormones. They're taking estrogen, testosterone, which should be like 10 steps down the line, but they don't do the other 9 steps before. to get the foundation right. Okay, so this is how hormones can really throw things off, and most commonly is cortisol issue. Now, infection, for example, let's talk about this. If you have an infection, the infection can literally knock the thyroid offline for up to 1 year if you have an infection. Okay, and one of the reasons is most people have hashimotos. You have autoimmune disease. Your immune system is already attacking the thyroid gland, and when you get an infection, your immune system goes way hyperdrive to try to get rid of the infection, but while it's being activated trying to get rid of the infection, because you're autoimmune, your immune system is also actively attacking the thyroid as well. And that can lead to a prolonged autoimmune flare-up and immune system dysregulation where it just gets out of control, and you can have that for a long time. So just getting infections can cause a lot of problems. We see a lot of people with chronic thyroid problem or Hashimoto's having chronic Epstein-Barr infection, chronic herpes simplex infection, chronic candida issues, or even bacterial issues. One of the ways that people can get Hashimoto's, for example, is if you get like strep throat. You get strep throat, which is bacteria, strep bacteria, and the bacteria can actually migrate from the throat to the thyroid because of proximity, and now you have lymphocytic thyroiditis from an infection, so now your thyroid gland becomes infected, and now your immune system is trying to get rid of the bacteria in the thyroid, but it's attacking the thyroid gland in the process, becoming like a collateral damage. So now you develop autoimmune disease as a byproduct having that strep infection. So that's just one way that can happen, but that can happen with viruses, with other things, and toxicity as well. So know that when you have an infection, that could throw you offline for up to 1 year. So this can be something that we need to address and detect. The problem is in a conventional medical model, when you have thyroid problem, they don't look at all these different factors that we look at. They basically give you thyroid hormone replacement, which is a thyroid hormone, the synthroid, levothyroxine, and then you go to the natural doctor, they give you Armour and Nature Thyroid, and they call it better because it's natural, it's bioidentical, which is not. Because what if the problem is an infection? What if the problem is a heavy metal? What if the problem is due to cortisol issues? Then taking hormone, doesn't matter if it's natural or not natural, it makes no sense because you're not addressing the root cause. This is so important because the philosophy or the model tells you how to go about it. And if your model is that, oh, I have a thyroid problem, I got to take a thyroid pill, that's how you're going to go about it. And taking the thyroid pill without addressing the underlying root cause won't get far. And that's why we have so many clients looking us up. And we really take a lot of time getting really geeky about analyzing these things. And it takes more time to do this, right? It's not a 5-minute visit. I just write you something, take this, you're going to be fine. It's working one-on-one. It's that relationship. I'm developing that relationship with you. And that relationship, long-term, is what's going to help you for me to transfer the knowledge to you. Basically, when you're working with me, what I'm doing is I'm compressing everything that I know over the past 10 years, 5,000 clients, and over $100,000 in education. I'm compressing that into these short snippets. I'm transferring that knowledge to you. And hopefully that if you know what I know, that you'll do what I do. And as a result, you're going to get better results. Instead of taking thyroid pill, taking thyroid medication, and that's it, without looking at the root cause. Now that you know more, you'll be able to do better for yourself and for your family. So hope this helps you. Please, if you like this video, if you feel like this is helpful, or I explain things that you probably already kind of know, but in a better way or clearer way so you get it better, please like this video, please share this video, and please comment in the comment section and let me know how this has helped you. And also, if you have any questions, put it in the comment section. I answer all the questions personally myself. And please share this message of hope and wellness with other people. So many people need to hear this message, and so many people are not getting the right program. They're not getting the right care, either because the provider don't know this, or sometimes the provider just doesn't really care. It's sad because I see it all the time. So please, we help clients throughout the entire country and globally through video teleconferencing. And so it doesn't matter where you are, we can help you. We can order lab tests where you are. We have supplements and detox remedies we can send from our warehouse to you. We're going completely 100% virtual. So if you're a client of ours locally in Arizona, know that this transition will benefit you as well, because the other day it was raining, cats and dog. We're in Arizona, but when it rains, it pours, right? The monsoons. I was just looking out, it's like, there's no way anybody can drive in that. I mean, the rain is just coming down like monsoon rain. And when we're doing these video consultations, you're in the comfort of your own home. You don't have to drive. You don't have to get stuck in traffic. You don't have to burn up gas. It's just end your time in your home. So it's great. It's been working out really, really well. And everything can be done virtually. In fact, it's better that way because you actually get a recording of our meetings. So you can review afterward, just like this. And also you get everything electronically sent to you. So this has been working out great for our clients. And so again, we take referrals. If you know anybody that need help, please send them to us. We'd love to help them. In the meantime, look forward to seeing you next week at the Ask Dr. Khan Show. Take care.